Hi, everyone, and welcome to the National Call on Coronavirus, Disasters, Housing, and Homelessness. I'm Sarah Savian. I'm Vice President of Public Policy at the National Low-Income Housing Coalition, and we will get started in just about a minute. Hi, and welcome everybody to our national call. I see that a bunch of people are still joining on the line, so we'll give it one more minute before we get started. All right, let's get started. We have a really strong agenda for you today on today's call. We'll get into that in a second, but before we do, just a reminder about who is joining us today. We have shelter and homeless service providers, housing providers and developers, housing advocacy organizations, low-income renters, and people who are experiencing homelessness. We also have on our call Hill staff from important congressional offices, as well as media and philanthropy. On today's call, we're going to hear about a new study on the connection between evictions and death rates from COVID-19. It's really important work that really underscores just how critical it is that we're able to get Congress to pass a relief package in the next several weeks that includes essential housing and homelessness resources in it, and that we need that package as soon as possible. It also underscores why it's so critical for the CDC, the Centers for Disease Control, to not only extend its eviction moratorium to provide the incoming Biden administration more time to take action, but also to strengthen it and to enforce it so that more renters are protected. On our call, we'll also hear about the expiration of unemployment benefits and what does that mean for households that are in need, as well as getting field updates from Ohio, Utah, and Texas. But before I get started, I want to let everyone know to look out for a national sign-on letter that we're launching tomorrow. This letter is targeted to the Centers for Disease Control to urge them to extend, strengthen, and enforce the eviction moratorium so that more renters are better protected, and so that there isn't a gap in protections between December 31st, when the eviction moratorium expires, and when the incoming administration can take action. And, as we've talked about on this call and in previous calls, when that moratorium expires, renters are going to owe somewhere between $35 billion and $70 billion in back rent. And the recent changes that were put out by the CDC have allowed landlords to file and take all the steps necessary towards evictions, despite the moratorium being in place. All that means is that as soon as the moratorium is lifted in less than a month from now, a huge number of renters will be pushed through the final stages of the eviction process very quickly. And we'll be seeing a lot of families and households that are in need. We're going to be circulating that letter starting tomorrow, and we're asking all local, state, and national organizations and elected officials to sign on. So please keep an eye out for it, and please share it with your network as soon as you can so we can get other organizations in your community to sign on. We have a strict deadline, I think, for getting signatures on this. We expect to close the letter December 15th so that we can share it with the CDC and with other federal agencies as soon as possible. Of course, All of us know that an eviction moratorium is not enough. We're still pushing for emergency rental assistance and other housing and homelessness resources, but it is really critical that we don't see millions of renters lose their homes this winter during the pandemic and during a resurgence of COVID cases. So we'll get started with the call right away. And as a final reminder, if you have any questions, feel free to put them in the Q&A box throughout the call for our speakers, and we'll make sure to get to as many as soon as possible. So our first speakers will talk about a new study. I believe it's published today, and we'll share a link to it in the chat box, about the connection between eviction moratoriums and COVID-19 infections and death rates. So we're going to turn it over to Emily Benfer from Wake Forest University and Kate Leifheit from Johns Hopkins University. And before they get started, I'll just point out that if you're not following Emily Benfer on Twitter, you're doing yourself a disservice. You should go look her up and get some updates from her on Twitter. So I'll turn it over to you, Emily and Kate.
Thank you so much, Sarah. Hello, everyone. It is an honor for Dr. Leifheit and me to be with you today to present on behalf of our interdisciplinary research teams. Today, we will be presenting on two studies that demonstrate the link between eviction, housing instability, and COVID-19 infection, transmission, and death. So let's jump right in. Next slide, please. Oh, there we go. Thank you. So in the first study, we will present on the effect of lifting state eviction moratoriums during the pandemic. Dr. Leifheit is the lead author, and Craig Pollock of Johns Hopkins University is the senior author of this study. Please note that this study is being released today as a preprint prior to peer review and publication because we are acutely aware of the time-sensitive nature of the results and wanted you to have them right away. Next slide, please. In the second study, we examined the social science and public health research to understand the link between COVID-19 and eviction, especially as it relates to health inequity among people of color and to identify immediate solutions. Next slide. Our research objectives were as follows. In study one, we sought to compare COVID-19 incidence and mortality in states that lifted their moratoriums to those that did not over an extended period of time. And in the second study, we asked why eviction, housing instability, and COVID-19 infection and death are linked, and why these crises are disproportionately affecting people of color. Now, Dr. Leifheit will describe the study one findings.
Thank you, Emily. And we can move to the next slide. So our study included all states that ever had a moratorium. So that's 43 states plus the District of Columbia, and they're shown in purple here. 7 states never had a moratorium according to our definition, and they're shown in gray here. 27 of the states that had moratoriums lifted them during the study period, which was from March 13th. That's the date that the first moratorium was implemented, through September 3rd. And that's the last day before the CDC's national moratorium went into effect. And the states that lifted their moratoriums are shown in dark purple here. Next slide, please. So here's a figure showing moratorium status over time. On the vertical axis is a number of states, 51 total, and on the horizontal axis is time, running from March through September. You can see from the light purple bars appearing that most states started their moratoriums in mid-March. The median date was March 19th. Then, starting at the end of April, states started to lift their moratoriums, which you see in dark purple here. The median date was May 31st. That means on average, the moratoriums only lasted 10 weeks. For the purposes of our study, we have a median of 12 weeks where states had no protections, and that's where we're looking to see effects on COVID spread. Next slide. These figures show our main results. They're a little dense, so I'll take some time to walk through them. First, though, I wanted to make sure to say that we controlled for COVID testing rates, stay-at-home orders, mask mandates, and school closures. We also control for underlying time trends and characteristics of states. So the graph on the left in blue is about incidence, or cases per population. On the vertical axis is an incidence rate ratio. That ratio compares the rate of COVID cases in states that lifted their moratoriums to the rate in states that maintain their moratoriums. On the horizontal axis is weeks since the moratorium lifted, and the vertical dashed line represents the moment that the moratoriums were lifted. It's important that before the dashed line, we're seeing a pretty flat trend, suggesting that cases weren't really going up before the moratoriums were lifted. After the line, we see a steady increase in effects. This increase reached statistical significance at 10 weeks. At 16 weeks and beyond, the ratio was 2.1, suggesting that the incidence rate in the states that lifted their moratoriums was over twice what we saw in the states that maintained their moratoriums. The graph on the right in red has the same setup, but it's about mortality or deaths per population. The increase in mortality among states that lifted their moratoriums reached statistical significance 7 weeks after lifting. 16 plus weeks after lifting, the ratio was 5.4, suggesting that the mortality rate in states that lifted their moratoriums was over 5 times what we saw in states that maintained their moratoriums. Next slide. These are those same graphs, but broken down by moratorium type. The dotted lines represent effects in states with moratoriums that froze stages 1 and 2 of the eviction process, or notice and filing. The dashed lines represent effects in states that only froze the later stages of the eviction moratorium, stages 3, 4, and 5, or hearing, judgments, and enforcement. You can see that the dashed lines representing those weaker late-stage moratoriums go up faster and show stronger effects. We think this is because in those states, evictions could be executed more quickly after the moratoriums were lifted. Conversely, in states with stronger moratoriums on notice and filing, tenants would need to proceed through the entire eviction process before being displaced, so effects on COVID transmission are slower to appear. Next slide. To make the results more concrete, we translate them into absolute increases in cases and deaths associated with lifting of moratoriums. These are national figures. You can see that the cases associated with lifting of moratoriums begin to appear in early July. By September 3rd, we estimate that lifting of moratoriums may be associated with over 400,000 excess cases of coronavirus. Deaths appear a bit later, in late July. By September 3rd, we estimate over 10,000 excess deaths associated with lifting of the moratoriums. I'm going to pause there for a minute to let those numbers sink in. Next slide. So our paper also contains an appendix with state level estimates. The number of excess cases and deaths in our model that our model predicts is driven by 2 main factors: the state's population and the date the moratorium was lifted. The larger the state and the earlier the state lifted its moratorium, the more excess cases and deaths we attribute to lifting. Here are some examples, roughly 1 state from each US region. Again, you can find estimates for all 27 states that lifted in our paper online. So Iowa lifted its moratorium on May 27th, and we estimate nearly 20,000 excess cases and over 350 excess deaths. Idaho lifted its moratorium on April 30th, and we estimate nearly 10,000 excess cases and over 150 excess deaths. Maryland lifted its moratorium a bit later on July 25th. So while we do see cases and deaths start to increase, the study ended before we got to those 7 to 10 weeks when the increases really become definitive. Overall states, out of all the states, we saw the largest increases in cases and deaths in Texas because it's a large state and it lifted its moratorium fairly early on May 18th. So in Texas, we see nearly 150,000 excess cases and nearly 4,500 excess deaths. With that, I'll hand it over to Emily to give some context for why we think we're seeing these strong associations.
Thank you. Next slide, please. So why does eviction increase the risk of COVID-19 infection and transmission? Well, without sufficient legal protections and federal and state financial support in place, the pandemic precipitated catastrophic business closures, wage loss, and unprecedented unemployment rates. Coupled with a pre-existing affordable housing crisis, this led to severe economic hardship in renter households. In August, researchers had estimated between 30 to 40 million adults and children were at risk of eviction and housing displacement. Well, this eviction and housing displacement forces families and individuals into transiency and crowded residential environments. And these environments increase new contact with others and make compliance with pandemic health guidelines difficult or impossible. Eviction also increases the likelihood of couch surfing and staying with friends and families who may themselves be at high risk for COVID-19. And this residential crowding and increased contact with others drive the spread of respiratory illnesses such as COVID-19. In fact, we found in one study, adding as few as 2 new members to a household can as much as double the risk of other illness. And that would apply to COVID as well. Likewise, smaller crowded spaces increase the spread of respiratory disease. The difference between having 45 square feet and 78 square feet of living space per person is associated with a 10-fold increase in the rate of illness. And for people who are homeless after being evicted, some cities only require as little as 25 square feet of space per person. So you can see how quickly transmission might occur in those settings. And in many cases, people facing homelessness will sleep in cars or outdoors, so they will only have access to public and not private restrooms or facilities. These environments prevent individuals and families from adhering to the CDC's primary interventions like social distancing, good hygiene practices, self-quarantining, or cleaning personal protective equipment. And by driving families into poor neighborhoods, eviction can also lead to less frequent COVID-19 testing. And in fact, the mere threat of eviction increases stress levels, anxiety, and depression, all of which weaken the immune system. So these responses all together ease the spread of infectious disease, including COVID-19. And because of the highly contagious nature of COVID-19, this increased contraction of the disease among individuals facing eviction quickly boosts transmission across a large segment of the community. As we enter the fall and winter months, housing instability will likely increase these risks of health harm. Next slide, please. We also looked at historic trends and recent data, which demonstrate that people of color are more likely to face both eviction and COVID-19 during the pandemic, which further perpetuates health inequity. In fact, Black households are more than twice as likely as white households to be evicted, according to pre-pandemic studies. And in one study of multiple cities, approximately 80% of people facing eviction were Black. Black women are evicted at the highest rates, higher than any other groups, and family status is also a contributing factor to the risk of eviction. During the pandemic, Black and Latinx experienced significantly higher job loss rates than whites. And at the same time, they entered the pandemic lacking wealth or emergency funds, which leads to an increased risk of eviction. When COVID-19 is contracted, Black Americans and Hispanic people are 4.7 and 4.6 times more likely to be hospitalized and die at as much as 2.3 times the rate of whites. They are also dying at the rate of white people a decade or more older. So the relationship between eviction, COVID-19, and health equity among people of color could explain why the effects of lifting moratoriums in the first study that was described were so much stronger for deaths than actual incidents. Next slide, please. And the harms of eviction will not dissipate once the pandemic is over. Eviction negatively affects every area of a person's life. It creates a barrier to employment and safe and decent housing. It has severe and long-term effects on physical and mental health, especially among women and children. And all of these effects create greater risk of COVID-19 complication and mortality and trigger a cycle of poor health, housing instability, and future hardship. Next slide, please. We conclude that eviction prevention is a necessary component of COVID-19 mitigation and recovery strategies. In light of the undisputed connection between eviction and health outcomes, eviction prevention becomes a key component today. Robust eviction moratoriums, especially those that freeze all stages of eviction, are a critical emergency measure to stop excess COVID-19 infection and death and to control the pandemic. In addition, with supportive legal and financial measures like rental assistance, eviction diversion programs, and civil right to counsel, states and localities are much better able to protect vulnerable residents from eviction. Policies such as increased access to healthcare, like Medicaid expansion, can also offer permanent pathways to reduce and prevent eviction and the poor health outcomes associated with it. All of these are described with the evidence base in detail in the papers. And as the research demonstrates, the COVID-19 pandemic magnified the connection between housing and individual and public health and underscored the urgency of eviction prevention. Protecting public health across the country requires protecting those most likely to contract, spread, and die from infectious disease, especially people in poverty and people of color who are more likely to face eviction and more likely to suffer severe harm during the pandemic. And we'll be happy to answer any questions you might have. Next slide. Thank you.
Thank you so much, Emily and Kate. Extremely powerful and compelling data that I know, I think really speaks to the urgency of this issue, and we're getting a lot of really great questions in the Q&A box. So if you have time, I'd just love to ask you a couple of the questions. There's a lot of questions about how do you control for other factors that might drive increased risk of COVID cases and deaths. So if the moratorium is being lifted at the same time that statewide lockdowns are being lifted or mask mandates are being lifted, how do you control for that in your data?
Sure, I can take that one. This is Kate. So we account for that in our statistical model. We include an indicator not only of where we are in time relative to the eviction moratoriums, but also where states are in time relative to when stay-at-home orders were lifted, when mask mandates were put into place, when schools closed, as well as testing rates. And then we also include what are called fixed effects in our model. So there's one for the week of the year, which is just to show that, to model the fact that the epidemic is evolving over time. And then we also control for what are called fixed effects for the state, which is a way to control for kind of time invariant or static features of the state. So for example, the politics of the state. So we do our best to control for those. We also ran a model where we control for businesses like bars and restaurants closing and reopening. But as you can imagine, it's hard to imagine controlling for every single thing that was going on in the states, but we do our best.
Yeah, absolutely. I'm seeing, are you able to share a link to the report or the paper in the chat box for people?
Yes, I'll add that.
Okay, great. Some other questions that are coming in, I think, let's see. Some folks, well, I was wondering, you don't make reference to the CARES Act moratorium that took place for several months that are covered in that time frame. Is that because it applied to all states equally, or it applied to all states and so it didn't help you suss out what the differences were?
Yep, that's exactly right. I think there's other papers that sort of look at, we expect that cases may have increased after the CARES Act moratorium lifted, but because that applied equally to all states, we couldn't evaluate it in our analysis.
Mm-hmm. Do you have any, so I think something that's on everyone's mind is, what would happen or what will happen when the CDC eviction moratorium is lifted? Do you have any expectation or analysis of what that could look like?
I think Emily maybe has something in the works.
So the study itself it's not forward looking. However, there are researchers who are attempting to model what it may look like once the CDC moratorium is lifted. Also taking a look at the eviction filings that occurred in between the expiration of the CARES Act and the issuance of the CDC moratorium. So trying to determine what that might look like on January 1st. Mm-hmm. If the current research is any indication, it will be catastrophic, and we will be hard pressed to recover from it as COVID-19 cases increase and any vaccine attempts are thwarted because of the amount of people who are transient and overcrowded. That's just a anticipation.
I see so many questions coming in, and they're all really good ones. So I'm going to try to get maybe one or two more and then ask you if you are able to stay on the line and answer additional questions that might be in the chat box or in the Q&A box. If you're able to do that, that'd be great. But one question we're getting from Meredith is whether or not you've shared this research with members of Congress and what, if any, reactions they might have had from this.
We have not shared this with members of Congress yet, and we encourage anyone who is in contact with their congressional leaders to do so as quickly as possible. This really does make the case for maintaining strong eviction moratoriums and preventing the eviction crisis as quickly as possible.
Absolutely. And to that point, we'll be sharing a link to these PowerPoint slides after today's call later this evening. So you should get a copy of it. You can share that with your members of Congress. And I'll also ask maybe Kim from the NLHC team if you could repost the link to the study and people could also share that with their members of Congress. That'd be very helpful. And I guess the last question I'm seeing from the audience before we move on is if you could help spell out why it is that the moratoriums taking place earlier in the eviction process, why that has such an effect. Is it just about delaying the process, or does it also have something to do with renters who might voluntarily leave their home before an eviction process can take place if the eviction process is allowed to continue further?
So this is Kate. I think we mostly understand that as just sort of a difference in timing. So, you know, in a state that was only blocking the enforcement of an eviction with its moratorium, then that means that when the moratorium lifts, you know, from one day to the next, it can mean that people are being kicked out of their houses and forced into congregate living settings. On the other hand, the states that block notice and filing, that means that once the moratorium lifts, tenants have to go through the entire eviction process before they get removed to their homes and might sort of be exposed to some of the COVID risk that we're seeing. So I would say that lifting either kind of moratorium, we expect to be associated with increased COVID incidence and mortality. It's just that the later stage moratoriums are kind of showing up quicker, if that makes sense.
Mm-hmm. Absolutely. Well, I think there's so many good questions that are coming in. I want to thank everybody for submitting questions. We're going to move on. But Kate and Emily, I invite you to answer folks in the chat box or in the Q&A box if you have time to do that. But everyone on the call, you've been given directions from Kate and Emily to share this report with your members of Congress and to use it to explain to them why it's just so important that Congress take action now to prevent these evictions from taking place. So it's a really good advocacy resource as well, and I hope folks make good use of that. But Kate and Emily, thank you so much for joining. We really appreciate your work on this.
Thank you.
Great. Our next speaker is Andrew Stetner from the Century Foundation, who is paying very close attention to the expiration of unemployment benefits. So Andrew, I'm going to turn it over to you to share with us an update about that.
Great. So thanks so much for having me. We have some slides. So my name is Andrew Stetner. I'm a senior fellow at the Century Foundation. Can jump to the next slide. We are a progressive think tank focusing on opportunity, inequality, and security. Next slide. So I'm just going to go over the unemployment benefits situation. Here's a flow chart for those who haven't been following this closely. In the darker colors are the benefits that are always there, and in the lighter colors are the benefits that were passed through the CARES Act. As people may know, the basic state benefit package only provides 26 weeks of benefits, and going into the COVID pandemic, only a quarter of those who are unemployed were even collecting state unemployment benefits checks. And you know, in recognition of that, the CARES Act, as described by Senator Schumer and Wyden, put jobless benefits on steroids. Those ineligible for regular UI, like gig workers, low-wage workers, part-time workers, many of your clients could receive benefits, 39 weeks of PUA benefits. Those who run out of the 26 weeks of benefits without finding a job can receive 13 additional weeks of benefits called PEUC. And in addition, $600 on top of the regular benefit, which averages about $310 per week, were added on to those checks in a top off. This package was so effective that Columbia University found that poverty, in fact, did not increase over the summer of 2020 due to the strength, in large part, of unemployment benefits and other related CARES Act programs. Unfortunately, the $600 per week supplement expire at the end of July, and all of these programs in the CARES Act programs are expiring at the end of December. In fact, they all expire on December 26th. We jump to the next slide. So what am I talking about? So all of those workers on either the PUA program or those are workers that are not eligible for state benefits, or those on PEUC, which are those who are long-term unemployed. In fact, 1/3 of the jobless have been out of work for more than 6 months now. Remember, most of the layoffs occurred in March and April and May, and we're now 6 months away from that. All of the workers on those programs, there are currently about 14 million workers on those two programs, and we predict that there will be 12 million of people still on those programs at the end of December, will no longer be able to get those benefits unless congressional action that takes place. Now, this is not the first time that Congress has passed temporary extensions of unemployment benefits. In fact, these benefits were expired and turned on multiple times through 2009 and 2013, but they've never been cut off this early in a cycle. We're only less than 1 year into this economic recession. This would be the earliest that benefits were cut off. And just to give you some perspective, at the end of 2013, 1.3 million workers were cut off these benefits, compared to 12 million that are facing this cutoff. Why is this so important? Well, we did mention that we've already lost the $600 per week additional benefit, but the $310 per week average UI benefit, has been studied extensively in the past, and it's basically been found that even continuing to get those regular UI benefits cuts the instance of homelessness or losing the family home in half. So we know that having just this basic income, really enables people to maintain, their housing security in many cases. And like our previous presenter, this nature of this pandemic has really changed. We're thinking about those who are subject to this cutoff of benefits. When all the closures first started happening in the spring, we saw, people in all walks of life, manufacturing, construction, etc., be on temporary layoff. As this has moved forward, those layoffs and continued unemployment have been concentrated in frontline service jobs, leisure, hospitality, and the like. And this is meant that it's really impacting frontline communities. Black communities, for example, were 40% more likely to be on state UI benefits at the end of the summer as compared to the peak of the pandemic in the spring. And as we were talking about, those who were on benefits, in the summer, they're running out of them now and relying on the federal aid, which is quickly expiring. With the next slide. So, that is the real, negative news, and why, it's so important that this cutoff not be allowed to stand, into 2021. The reality is there won't be much left for these workers after December 26th. I do want to mention, a couple of these, key points about it. There is, if we remember that very first slide, there is a program called Extended Benefits. That's a permanent program under law that comes on and provides benefits when the unemployment rate is very high in a particular state. So the core rate that is used in this case for determining whether states are paying this benefit out or not is only related to those who are on unemployment insurance. And you can understand how that's a big flaw given how few workers are collecting benefits at this stage. Nonetheless, we do estimate that 17 states and DC will be triggered onto the Extended Benefits Program, known simply as EB, at the end of the year. So that'll be roughly 2.9 million of those 12 million workers will have some form of benefit in January. So only a small share. This is a big challenge because after January 1st, these benefits will be required to be paid 50%, by the states. It'll be no longer a federal program; it's a federal state program. So that's going to increase the burden on states at a time that's very difficult. And we know that in addition to the 12 million who will be cut off on December 26th, many people have already run out of benefits. Not everyone gets the full complement if they don't have a full work history. So for example, 1.5 million have already exhausted their extended benefits by the end of October. And we think that number of people that are running out even before the cutoff will rise to 4.4 million workers. So it is really a jobless benefits cliff that we've never seen before in this magnitude. I want to emphasize that the PUA program is much broader than what we typically think of for jobless benefits. Individuals can get it if their children's school is closed and they can't access daycare. They can also get it if they're taking care of an ill family member with COVID-19 or they themselves have COVID-19 and cannot work. They can also get it if they had a job offer, but one that was rescinded because of the lack of opportunities due to COVID-19. So we've really expanded the safety net. It's been hugely effective, but we are now kind of pulling the rug out of people and pulling the rug out of the economy. These benefits circulate in local economies and help to prop up small businesses themselves that are hurting for the lack of customers. So it really is a short-sighted policy that will have these benefits expire on December 26th. We can jump to the next slide. So in terms of these numbers, obviously this is a national effect, but it differs both, in terms of thinking about service delivery and policy about what's happening on the state level. And I did say something that flashed in the chat. People wanting to know what the state numbers are at. We have a longer report that goes through everything in these slides. It's right on our homepage at www.tcf.org. We also have a dashboard that has all the data in this report and also a lot of other data around unemployment insurance benefits. But you can see, this is an interactive map, in the report. You can click on any state and get the number of workers impacted by the cutoff and whether or not that state will remain on the extended benefits program. This is also put in tabular format in the report. Go to the next slide. So we can talk about what is happening next with the CARES Act extension, and I'm sure you've been following this closely yourselves. There is, a hope for an inclusion of the extension of CARES Act benefits, and we think now the real only vehicle for that will not be a separate bill, but in fact, the end of the year budget agreement for 2021 that will include certain aspects of COVID relief. We were heartened to see that there were some bipartisan talks this weekend. The key action location is the Senate, given the House's strong support already for this. But it's a difficult fight over the next few weeks. We would hope that both the benefits are extended, including longer length for PEUC and PUA, and also that we get back that top off of benefits that expired in July. The target states are listed here on the slide. These are states in which we think senators are movable on the issue of doing some type of relief package in the current Congress. We also, we are happy to help with these statistics. We have some shareable graphics that also are available for those who want to, work in these states. And this will continue on into 2021, into, whatever COVID package the new president puts into play, doing action on issues that don't get addressed, in this current iteration. It may be very short term what we pass, in this Congress. We do expect legislation kind of laying out what a longer term package would be. And the basic idea of all these packages is, rather than just throwing out an arbitrary date, that we get to a place where we know that this aid will be in place until the unemployment situation improves, until the unemployment rate goes down, and as obviously the vaccine comes into place. We need these benefits as a bridge, not to some arbitrary date, but until we start to truly emerge, from this crisis. So happy to take any questions, and thank you for the opportunity to talk about what's going on with UI.
Yes, thank you so much, Andrew. And I know that on this call in past weeks, we had talked about how the extended federal benefits for unemployment was really critical in helping people pay their rent and stay in their homes. It's not perfect. There are gaps in UI, but for many, many, many households, it was a real difference maker. I see a couple of questions. One, folks are wanting to know this list of targets and your slides. Both of those will be shared in our email following the call. So we'll make sure that folks get that so that they can be engaging with their members of Congress. I do see some questions about, what are you hearing in terms of Republicans supporting an extension of unemployment? We've seen throughout this year that the Senate has blocked lots of legislation from moving forward that the House has put forward. Is this something that you're hearing from Republicans that they're sympathetic about?
I think sympathetic is a strong word, but I do think there's beginning to be some recognition, even on the Republican side, that we can't afford to let this kind of cutoff happen, at this stage in the pandemic, and politically that would be a danger. So I do think, as I mentioned, there are some bipartisan talks, talking. Senator Romney has been outspoken. There was some, Susan Collins as part of the discussions this weekend. Even John Cornyn tweeted out my report to his followers saying we have to deal with this. So I do think there's some recognition, but we really did hope we'd be further along at this stage in the negotiations.
I have a couple of questions here for you too. One, folks are asking, do you expect Washington, D.C. that will be treated as a state for unemployment aid, or is D.C. treated differently than other states?
Yeah, no, it's treated like a state in general, yeah.
Cassandra is asking about recipients of UI benefits who might have been billed for overpayment. Is that something that you've seen in other places, and what can be done to help protect those households?
So it's certainly a big issue right now, is a lot of people are being billed for overpayments, many of which are occurring for agency error. Under the CARES Act, any overpayments for PUA cannot be waived in any circumstance. We do hope that can be corrected in legislation. However, states, even under PUA, are given some options for how the recovery of overpayments is operated on. So the most important thing is, if you do have a client that is facing an overpayment, to not view it as a bill that they have to pay immediately. There's a ways in which the overpayment can be recovered. And also you do have appeal rights. If you think that overpayment is being assessed to you inaccurately, it's very critical that you have a certain period of time, 15 to 30 days, to appeal that overpayment. And so you need to appeal it in a timely fashion, even if you don't have all your full legal case together to appeal that overpayment.
Yeah, thank you, Andrew. That's very helpful. One other question that I'm getting is whether recipients of unemployment will be taxed on this income. This is an important question when it comes to eligibility for housing programs. Could you tell us a little bit about what the rules are around that?
Yeah, so unemployment benefit income is taxable income. The taxes for state benefits, all workers are given an option to have those taxes withheld at the time that they're paid. States are not required to give that option for PUA benefits. So, not every worker may have been given the chance to hold the taxes. Regardless of that, workers will get a 1099-G from their state after the new year that tells how much money should be put into their tax calculation. In addition, there has been a proposal that all PUC benefits, that $600 extra, be taken away from safety net calculations. So that's not current law. That's just a proposal that's been in some of the bills.
Great, thank you so much. And Andrew, I just would encourage you, if you have the time, to stay on and answer additional questions that might come up in the chat box or in the Q&A box. But we really appreciate you joining us, because this will have a big impact on whether or not renters are able to pay their rent in the coming months.
Thanks so much for the opportunity.
Absolutely. We're going to move now to our field updates. We're starting with Bill Faith from the Coalition on Homelessness and Housing in Ohio. Bill, are you there?
Yeah, I'm here.
Great, thank you.
So we could go to the next slide. So I just wanted to tell the story a little bit about how we experienced the COVID crisis related to homelessness and housing in Ohio, and to talk about some recent victories we've had to hopefully let you know that even if you're really late getting things done, there's still an opportunity to get it fixed. So back in the spring when COVID first hit, our first focus was on the homelessness issues across our state. We had 300 shelters that serve at least 10,000 people a day. And these groups are not government sponsored. They're nonprofits working on their own, and with sometimes government funding, most of the time government funding. But they had no sort of readiness for this. They didn't really know how to deal with it. They didn't have much guidance, training, anything from the public sector. So we stepped up and did a lot of that work, hosted lots of webinars and other trainings so that people had some idea. These groups, you could imagine being a very overcrowded shelter, the staff had no kind of PPE, no disinfectant, no sanitizer, no mask in the early days. So we actually got involved in procuring those kinds of supplies and getting that distributed around the state. We also, there are lots of challenges, as many of you all probably know from your own areas of the country. Things like, shelters often overused volunteers for a lot of different things in their shelter, from serving meals to other staffing needs. So many of those volunteers were seniors, so they were either asked to not volunteer or took it upon themselves to not come in anymore. So we really had to rally with getting extra funding to the groups to help them supplement what they lost with volunteers. We raised money through what we called the Ohio Pandemic Emergency Fund. We got up to about $1.9 million and made many grants out to groups around the state to help them get over the period from when the pandemic started to when any kind of government distribution of funds started. Next slide. So basically, we advocated on multiple fronts with multiple different state agencies to step up, to identify funds they had available, to step up resources to combat all these problems. Some victories we got were $15 million, which the governor provided to us to distribute to do rehousing programs around the state to get homeless families back out of shelter or out of the risk of going to shelter. Basically, they provided this 15 million, and we could ask for more funds or increased allocation as the demand presents itself. So that program has started late this summer, early fall, and the money is getting used across the state. We also set up with some of our own money a risk mitigation fund to try to entice landlords to work with some of the people coming out of shelter, either into permanent supportive housing or in a rapid rehousing situation, to try to recruit and retain landlords so that we would share some of the risk if they ran into additional expenses. That's been a big challenge, finding landlords willing to participate with some of these programs. Our housing finance agency, in an unusual move, freed up $11.5 million of money in their reserves that went out to various homeless groups throughout the state. They normally don't fund homeless programs. They fund housing development projects. But in this case, they stepped up and did some extra duty in getting those funds out early before some of the other dollars started to roll in. And I list there on the slide some of the ways they distributed that $11.5 million that they provided. Next slide. When it comes to emergency rental assistance, I got to give a shout out to all of our local advocates and communities across the state who rallied to find any money they could to apply toward emergency rental assistance. They used local CDBG dollars, community service block grant dollars, which were money available through the community action programs, PRC, which is a emergency cash assistance program available through the basically the welfare system. So all of those funds were brought to bear. Some of the groups used federal coronavirus relief funds from the CARES Act to help supplement their own rental assistance programs. Some local governments kicked in money, although local governments were struggling with their own tax collections, so they weren't able to help except with this federal money that they had passed through. There were a number of foundations and other philanthropic outfits that also kicked in money. But you could see this notice from one of the websites where new applications for what they call the Home Relief Fund were closed. They just basically got, this is from Franklin County in Columbus, they basically got inundated with requests and had to shut off the application process. So demand, was certainly outpacing the local resources. So next slide. We began to target our governor for kicking in or, putting emergency rental assistance dollars on the table. Ohio received $4.3 billion of federal coronavirus relief funds, which was one of the targets that we went after. Starting in early June, we did a big sign-on letter with lots of different organizations coming on board, from realtors, bankers, all kinds of nonprofits, people in the healthcare industry, all kinds of groups signed on to this letter, calling on the governor to free up $100 million for rental assistance. And after months and months of badgering the administration, doing lots of press conferences, lots of roundtables, lots of outreach from other constituencies, including the realtors and bankers who helped go to bat for this. After many months, in October, the governor finally announced $55 million in coronavirus relief funds for rental assistance, mortgage assistance, although that is a smaller component of how much money is going out, and limited utility assistance. The only utility bills we're paying with these dollars are certain kinds of water bills that are not publicly regulated. These are private water companies, primarily in rural parts of the state, and they were executing shutoffs, so this money could help take care of that problem. And then just here in November, a couple weeks ago, the state announced another $55.8 million for the same purposes through the CDBG COVID dollars that came out of the CARES Act. So these are the supplemental appropriations of CDBG dollars that the state controlled. And I got to give a shout out to the Development Services Agency, which helped to advocate for this to be done. And this, again, took a lot of extra effort, over many, many weeks of pounding on this door. Finally, with the help of some people in the legislature, they persuaded the governor to put this back on the table and do additional allocations. So that's been a boost to the efforts. I have to say that even with this almost $111 million of rental assistance that's making its way out as we speak, it's going out at such a pace that without a huge rental assistance program established through action by Congress, our own Senator Sherrod Brown has been championing $100 billion legislation to provide for rental assistance. Unless we get something like that, we're going to go very quickly back to more and more evictions, as we won't have any funds available for rental assistance. So last slide. The funds are being distributed through our local community action agencies. After reviewing all the various options, the community action agencies have the advantage of being able to cover pretty much everywhere in the state. They are used to doing emergency assistance of various kinds. Many of them are good partners of ours. We work closely with them. So they're the ones that are distributing the dollars. Tenants wanting assistance would seek assistance through their local community action agency. And again, it's for outstanding rent, mortgage payments, or certain kinds of water bills dating from the period of April 1st through December 30th. Now with the CDBG dollars, we're able to extend the rental assistance on into January, pretty much as long as the money lasts. We'll run out of money before we run out of time. So the eligibility is limited to residents at 200% of the federal poverty level. So those are just some basic elements of the program. The only way we can continue this effort, as I said, is with a large allocation of resources from the federal government. So thank you very much. I'm happy to try to answer any questions.
Yeah, thank you so much, Bill, for joining on. I think we only have time for one question. And, it sounds like this has been a really good exercise in working with other partners in the state to make some moves here. And I'm wondering what advice you might have to other groups that want to engage with their housing finance agencies to get more resources put to responding to the pandemic. Maybe you can give us a tip or two about how that relationship looked like or what work you did on that.
Well, we really had, we sort of embraced the strategy of having multi-sector partners weigh in on this and tried to get it activated, get activities going from a lot of the business community, which we viewed as having better access and influence with the governor. And so the ones that really did step up were some of the landlord groups, although not all of them. The realtors were really pretty good at voicing their support for this, as were the bankers. We also had a lot of help from the healthcare industry. And we just wanted to make sure that throughout the period of time we advocated for this, which goes on almost 5 months, that they would keep hearing about this from other sectors. It wasn't just us calling for it, but they would continue to hear from it from other sectors. And the Housing Finance Agency stepped up really on a lot of it was on their own. I mean, I asked them to help, but they did step up. Their board wanted to take action to help on this issue. So I got to give them credit for doing so.
Yeah, great. Well, thank you, Bill, for joining with us. We appreciate your work on that. We're going to move now to our next field update from Utah Housing Coalition, and we'll hear from Francisca Blanc. Francisca, go ahead.
Thank you so much. I am with Utah Housing Coalition, and we really appreciate this opportunity to give you some information what's been happening in our state. I'm the advocacy and outreach coordinator with the organization, and we are a membership-based statewide organization located in Salt Lake City. We provide education, outreach, and advocacy in support of affordable housing. Our 125 plus members and partners are affordable housing practitioners, social service providers, developers, financial institutions, and state, county, and local government entities. And the first slide of the presentation is we want to kind of to give you a broad idea of what's been happening in our state. The data is from January 1st to November 9. These are the 211 calls throughout the state. And as you can see, the utility assistance and the rental assistance, are the highest priorities for our residents. Next slide, please. So we had a shutdown in Utah on March 16. On April 1st, our current governor, Governor Herbert, issued a statewide eviction moratorium valid from April 1st to May 15 of this year. And then, of course, we had the CARES Act moratorium that ended at the end of July. And then September 4th, we had the CDC national moratorium. Next slide, please. I want to share with you some of the data regarding eviction filings in Utah courts, and I wanted to show what's been happening in 2019, which is kind of the regular trends in our state, and what has happened this year, beginning of the year, and then during the pandemic. As you can see, January, February were the kind of the regular eviction. March was the same. You can see the down sharp on April 1st with the statewide moratorium expiring on May 15. They started to move up a little bit, and right at the beginning of August, it skyrocketed because the CARES Act moratorium has ended. And in September, you can see a drop again, and that's because of the CDC moratorium. One thing that we as a coalition, we did great since actually the start of the pandemic. We put together numerous working groups to provide education and outreach in our community, making sure people know where to access rental assistance, make sure they know their rights as tenants. And since the CDC moratorium, we have been meeting every week to discuss what's the latest on the moratorium, what are the national news, what's happening in our courts, what the tenant lawyers have been seeing, and what kind of, what are the things we can do that to help our community. Next slide, please. The CARES Act rental assistance money from HUD that was dispersed among the community action agencies across the state, and this data, it is April 1st, October 26th, and you can see that by the end of October, it was a 386% increase since July. And we also seen quite a bit of increase in assistance in July and August because the state has set aside money, $500,000 to do advertising basically for rental assistance and where people can get help. Next slide, please. The other source of rental assistance for us was discretionary funds from the CARES Act money that the lawmakers had available. So they set aside $20 million for that. And what you are seeing in this graph, it is the Housing Assistance Program funded through October 26th, but it's from the first round of money that came available in spring. The strategy in our state was that to spend first the CARES Act money from HUD, and then when the other $20 million will kick in, then that will gonna be the first priority of spending. So that's kind of how the community action agencies have been doing. So the number that you see, the total funded amount, $4.6 million, that probably was spent up to, I would say, middle of August. And then the $20 million kicked in after that. Next slide, please. So the $20 million funds are very flexible. The income limitation is 100% AMI, and it could cover rent, fees, deposits, multiple months, and can be up to $2,000. Out of the initial $20 million, our state lawmakers set aside $8 million for a landlord housing program, meaning the landlord can apply on behalf of the tenants directly to the state. And as of today, we are out of money of the $20 million. Next slide, please. The other thing I want you to see is the call to mediation. So the only landlord tenant mediator that works for a nonprofit organization, which means it's no cost. It's based at Utah Community Action Agency. And these are the calls from April to October 20th, the end of the month. In total, she received 844 mediation calls. And out of those, about 286 were actual mediation cases that she had, and she was able to help over 200 households stay in their house and not be evicted. And you can see the highest number of mediation calls is for rental assistance, but it is also lease terminations, which is the latest kind of tactic of the landlords to get around the CDC moratorium. Next slide, please. This is the dashboard for the homelessness data. And one aspect that the service providers noticed is that since April, 70% of the people who entered the homeless system are first-time people who access these services. Next slide, please. And lastly, we presented a very similar presentation at Utah Commission on Housing Affordability because We knew we are out of funds by the end of November, and we knew that the CDC moratorium will expire on December 30th. So the commission took action, and they were going to meet with the newly governor-elect that we have in our state, and they were going to provide them with a couple of items where we can ask rental assistance for December and January, and rental assistance and an extension of moratorium for the month of January. We do not know yet how that will gonna happen, but what we know is that as of this weekend, the state has $307 million CARES Act money to spend, and we know that state lawmakers are meeting today to address this, and the state is requesting an additional $50 million for the month of December for rental assistance. This is kind of a snapshot of what's happening in Utah. I appreciate you so much, National Low Income Housing Coalition, for giving me this opportunity. I'm open to answer any questions.
Yeah, thank you, Francisca. So you'll find out today about the governor's decision of providing more resources?
Yes.
Well, let us know how that goes. I think all of us are keeping our fingers crossed for you, and it seems really clear from the data that you shared just how important it's going to be, especially as this eviction moratorium by the CDC expires. So good luck to you in your efforts there.
Thank you.
We're going to go on to our next speaker, Elaine Morales from the Local Initiative Support Corporation in Houston. That's LISC in Houston, and the Houston Housing Stability Task Force. Elaine, go ahead.
Thank you. Hi, everyone. Thanks for the invite. We just wanted to share with you what the Harris County Housing Stability Task Force has done since the summer at the request of the National Low Income Housing Coalition. It's great to see all the data that you're all collecting, considering that it's been so hard to keep up with this crisis only with eviction filings without knowing what informal housing displacements are happening. Okay, next slide. So the reason why the Housing Stability Task Force was created, we are not a politically appointed group. However, it was called by both COVID-19 recovery SARS with the purpose of addressing the effects of the rental housing crisis to avoid a spike in the evictions that we were seeing locally. The goals were to prevent an increase in evictions, mitigate the effects of this crisis, and stabilize both households and landlords for the benefit of public health. So who is on it? This was created kind of ground up, asking the county and the city to put together a group of cross-sector members that had representation from tenant advocates, landlords, service providers, and affordable housing actors to come up with solutions and immediate recommendations for city and county leadership to address these crises. And LISC Houston has acted as backbone agency of the effort. Additional community stakeholders and supports have been engaged through work groups and other piloting initiatives. Next slide. Our work, even though we are trying to look at the housing stability cycle not as one moment in time in which you have either an eviction filing or eviction proceeding, but look also at the instability before that eviction or informal displacement happens, and also in the rehousing. However, we didn't want to overlap our work with either the Homeless Coalition work, which is also part of the task force, nor the long-term affordable housing actors in the city and the county. So the work of the task force has been focused on the population at risk of eviction and the eviction proceedings. Next. We began our work in July of 2020 and we have focused in addressing urgent issues, influencing the local response, and recommending immediate interventions. And we hope that by bringing together this diverse group, we can influence the long-term housing stability strategy that we see in the county. Next. So Harris County during COVID, we've seen about 16,015 evictions filed since March 15th. Thanks to January Advisors, who is also sitting as a task force, we have bi-weekly updates and keep their eviction tracker in our website as well. And currently we have 2,524 cases on the docket. Only about 3.9% of defendants had legal representation. We've also participated in some tenants and landlords focus groups and interviews. And what we're seeing is that even though tenants are struggling to pay rent, they prioritize their rent payments. And this is important, especially because both of the rent assistance programs that we had both in the city and the county are covering rent arrears and the debt or previous months, and not covering current and future months. So one of the recommendations we are moving forward is meet tenants where they are. Many tenants prioritize maybe the last month's rent, but they are not able to pay current and the next month's rent. So how local rental assistance programs are flexible to meet that need. Also, many tenants do not know what to ask from their landlord. There's overall frustration in navigating the assistance. And some tenants are preferring to leave the unit as soon as they get the notice to vacate, especially if they have an undocumented family member. The landlords, they are having trouble collecting rent payments, and even though they want their tenants to be communicative, they are also not all aware of the resources available. And last month, a few of the landlords that we talked to, they were not aware of the CDC halt on evictions. And what they said is that, well, I wasn't even planning of filing an eviction until January, but I guess I'll wait till February. So that also gives us an idea that maybe landlords are waiting till the end of January to start filing additional evictions. Some landlords have shared that direct cash assistance is helping them, and they are trying to help their tenants with the applications, but they admit that more technical assistance is needed during the application process. Expansion of HOT Section 4 would be helpful. Relief to assist in rising insurance rates would help. Low interest line of credit and more collaboration with local banks and additional financing opportunities. And recommending an extension of the homestead exemption for rental units with long-term tenants. We at Houston LISC have adapted a grant program that we had that was meant for small business owners to target small landlords in high-risk areas in the city. So we are going to be allocating some resources for small landlords. Next. So we have prioritized 3 work streams. First, responding to immediate requests from city and county leadership. In July of 2020, there was a lot of discussion publicly about following Dallas and Austin on a grace period ordinance. And the task force got together both landlords and tenant advocates to recommend and draft a grace period ordinance that both groups felt comfortable with. We submitted that to city leadership, but the mayor did not move the recommendation forward. In August 2020, we also submitted to both the city and the county a set of 10 principles that all local rental assistance programs should follow, and that's available on our website. These 10 principles were triggered by the City of Houston Rental Assistance Program, which was first come, first served, and was depleted in the first 90 minutes from when it opened. So we were really worried about the equitable distribution of those funds. We have also launched some work groups. Currently, those are working on recommendations and discussions on what steps should the county take when the CDC order expires. The rental assistance work group have submitted recommendations on how to better align the city and the county rental and direct assistance programs to distribute $60 million on rental assistance and $45 million on direct assistance. Actually, we are expecting this week that City Council is going to add an additional $20 million on rent assistance within the city limits, and that the county is going to add to Catholic Charities direct assistance the same amount. The group also worked on a rental assistance auction concept to try to expand assistance to more residents in need. This was to test or kind of try out how you can still help landlords and tenants, but negotiate how much debt you could cover to be able to help more residents in need with the amount of money that the local city and county had. In the Access to Justice work group, we focused on ways to help both tenant and landlord before a eviction was filed or a notice to vacate was delivered to the tenant. We worked on currently we have a pilot that it's a community-based organization-led tenant landlord facilitation pilot. And we have a concept for a web resource for tenant assistance. Both of those descriptions are on our website. And we have 3 CBOs currently trying to facilitate conversations with tenant and landlords and distributing and negotiating rental assistance to keep tenants housed. We also launched a landlord and property stabilization work group that is currently ongoing and focused on which programs can the local jurisdictions explore to assist small and medium-sized landlords, especially in high-risk areas. And we've worked to develop shared knowledge base for the members through eviction filing tracking, updates from the rental and direct assistance programs in the county and the city, and biweekly presentations. Next.
I think I'm going to have to interrupt you there, Elaine, if I can.
Okay.
I'm seeing some questions about sharing maybe further information in the chat box, including information about the principles of this working group and the efforts that I see that. There you go, housingstabilitytaskforce.org, so that people can look up more information. Thank you so much for being with us.
Yeah, all of the presentations that we've shared with the task force are there as well.
And just one more question for you before you go. I'm seeing a question about community engagement through this process. Maybe you could speak a little to that too.
So we have very diverse representation in the task force, but we are including other community members through the working groups. And now through this website, we're trying to keep a lot of transparency, uploading our meetings and all the materials that the task force developed to be publicly available. And we've engaged directly tenants and landlords through the focus groups and interviews.
Wonderful. Thank you so much, Elaine. Thanks for joining with us.
Thank you.
Now I'll quickly give an update about where things stand in DC. Things are making, there seems to be more progress being made in terms of a spending bill package. We know that Congress has less than 2 weeks until December 11th when the current continuing resolution expires. That means Congress has to either pass a spending bill or another CR, or we would risk seeing a government shutdown. There seems to have been a lot of progress made over the weekend where the House Appropriations Chairwoman, Nita Lowey from New York, and the Senate Appropriations Chairman, Richard Shelby from Alabama, made some progress in reaching some high-level numbers for the spending packages and have apparently negotiated some other provisions that we thought might hiccup the process. So it sounds like from reporting that the two have worked out different allocations for the different spending bills, including the spending bill for housing and community development programs. We haven't been able to chase down exactly what those numbers are, and we're looking into it, but we don't have that information available to us just yet. It also sounds like they've made progress on sorting out some hurdles that had been in the process. I think the last couple of weeks we spoke about how the White House had made a push to no longer exclude veterans' health programs from the low spending caps that were in place. That would have had a really big impact on funding for housing programs, but it sounds like this meeting over the weekend has resulted in some sort of resolution around that, although we're not exactly sure what that resolution is. We will see something on a spending package, I think, in the next week or so. It's not uncommon for Congress to pass a 1-week extension of a CR to give them a little bit more time to hash out some details so that they can pass a bill. So I think we're going to see some movement one way or the other in the coming week or so. There's also increased pressure, again, to add some emergency relief resources to a spending bill. So it wouldn't be the full comprehensive coronavirus relief package that we've all been pushing for. It might be something much smaller. We're starting to see more Republicans in the Senate weigh in on this and about the need for that assistance. So we should continue to keep up the pressure. My biggest fear is that there might be a relief package, but we need to make sure that housing and homelessness resources are included in that. And in part, that's because it'll take quite a bit of time for state and local governments to administer those funds to reach households in need. And we also know that at the same time, there's an eviction moratorium that's expiring. We have been engaging with the CDC and encouraging them to extend the eviction moratorium. And in light of the pending deadlines, we're also making a really hard push for Congress to step in and pass a statutory moratorium. We'll see how that goes. I know there's a lot of pushback, especially among Senate Republicans for that. I see a couple questions. One question is about whether or not President Trump might refuse to sign a spending package or a spending and relief package. That's always a risk, especially with this president. Things can be a little chaotic. I think, though, that if Congress and the White House were able to, the House and the Senate are able to reach a deal on a spending package, that I think President Trump would go along with it. And if not, they would postpone those decisions until Biden comes in, so we do something just a couple of weeks later. Meredith is asking whether or not we're hearing any rumors about whether housing is a part of any bipartisan negotiations. The details of that are really unclear. We know that people are talking about this, and we are making as strong of a push as possible for why emergency rental assistance and other resources are really needed. It sounds like, despite the reporting in the news, that there isn't this group of 8, coalition of Republicans and Democratic senators that are hashing out a bill. Instead, it's really just them having conversations about putting pressure on their leadership to strike a deal. At least that's what we know so far. And so the Republicans we know who have switched over or who have been able to or willing to speak publicly about the need for a relief package now include Mitt Romney from Utah, Susan Collins from Maine, Murkowski from Alaska, Portman from Ohio, Cassidy from Louisiana. So if you are in those states, you have a really important task ahead of you to support those senators and pushing them forward to reach a deal. I will say more generally, our focus has been on any Senate Republican. That's really where we see the most need for pressure. And so I encourage you to keep up that work over the next couple of weeks until we see whether or not a deal is possible in the lame duck. Before we head out, I just want to remind folks that we are going to be launching a sign-on letter tomorrow, urging the CDC to extend the eviction moratorium, strengthen it, and enforce it. The letter is going to be open through December 15th. This is an organizational-only letter, and so we're asking only folks that are associated with organizations that have the ability to sign on to do so. The only exception to that is for elected local officials. They are welcome to sign on as individuals, but other individuals, this is just not the appropriate way for you to weigh in. Instead, we encourage you to call your members of Congress and weigh in with them directly, if that's okay. So thank you so much for joining today's call. We really appreciate you participating and asking some great questions. We'll talk to you soon about ways to continue to engage on this issue and to hopefully see a deal passed in the next couple of weeks. Thank you.